Hello, I chose to do the part 1 of the project on patterned electrical neuromuscular stimulation, also known as PENS, by me, Victoria Melendez. So to get started, what is PENS? So PENS is basically a form of electrical stimulation that replicates proper firing patterns after an injury. So I found in the journal articles that they mentioned most likely in a knee joint injury. So the stimulation fires at the agonist muscle and then at the antagonist muscle and then again at the agonist muscle in order to replicate those proper firing patterns. And experts believe it is useful for muscle contraction during prolonged periods in the immobilization stage. So basically after the athlete hasn't been able to do those proper muscle contractions on their own, that's when the PENS come in, and while combining it with some simple exercises like the picture there, she's doing a jumping squat, combined with the PENS, it'll help them with those muscle contractions. And it began in the early 1800s in hospitals when doctors realized that electrical stimulation actually had an effect on muscles. And it wasn't until the early 1900s when physicians started using the stimulation or electrical stimulation devices we have today. And they're typically used in physical therapy facilities, so whether it be in a hospital or in a clinic, usually physical therapists are using them. Some PENS effects, some side effects that it might have would be discomfort and or pain. So due to electrical stimulus targeting the injured muscle groups through the nerves, the athlete might be experiencing some discomfort since they are injured and the contractions are happening from a device and not necessarily on their own, or it's rather assisting them. It might be uncomfortable. And then also some skin irritation since the electrical waves do have to travel through the skin and into the muscles. It might cause some irritation through the skin depending on how high the electrical stimulation is. So some physiological effects may be an increase in blood flow and circulation. So since the PENS is being combined with a simple activity, whether it be like step-ups or lateral raises, it's going to help with that blood flow so the muscle contractions can come almost naturally to them since it is mimicking firing patterns, which is another physiological effect of the PENS unit. So contraindications would be if a woman is pregnant, she should not be using any electrical stimulation. If the patient has any allergies to adhesives, since the pads do have adhesives on them when they're sticking onto the body. If they have any burning sensations while using the PENS at all, they should not be using it. Or if they have a pacemaker, they should most definitely not be using the PENS unit since it is electrical stimulation, and it should not be used over the chest or any of the major arteries in the body at all. And some efficacy rates. There's not a lot of research on PENS yet, but recent studies I found in the journals show that patients that use PENS are compared to patients that used a placebo, and they show that they have greater rates of success in muscle rehabilitation. The ones that had used the PENS combined with the everyday activity, they showed better rehabilitation to those who didn't use a PENS or had a placebo effect. So it shows that it works, and if they had some more natural muscle contractions, I think that would find some pretty cool stuff. And I actually found it to be pretty interesting on it. That they're using electrical stimulation. That's it. Here's my works cited, and thank you for your time.